The volunteer program at UC San Diego Health depends on a dynamic group of individuals. Each bring their unique talents and experiences to the program, enhancing the services provided for our patients and guests. Our volunteers partner with team members and together create a healing environment for patients across our medical campuses, outlying clinics, and facilities throughout San Diego County. Whether you are retired, working, or a student, participating in the volunteer program is a rewarding experience. Many choose to continue well beyond the 100-hour service commitment we request. I know I speak for everyone at UC San Diego Health in expressing appreciation for the dedication of our volunteers and the recognition of volunteers as integral partners in the healing process.
As a volunteer, one of my favorite things is greeting people as they come in the door. You can oftentimes see the anxiety on their face and being able to show them exactly where they need to go, so that takes off a little of the confusion, get them there as quickly as possible. All of those things just really, I think, add to lessening the anxiety of our guests that are coming in, and it also makes me feel good knowing that I've helped them get to where they need as quickly as possible.
Volunteering is not work. It is a joyful experience. I have found that of all of my careers, even though they've been diverse, I was a retired naval officer and secondly a retired engineer, this is probably the most meaningful and joy-giving work that I have done.
One of the things that I do as a volunteer is I call patients after, if they're an outpatient surgery, I'll call them for a follow-up, and pretty much all of the time they're very exuberant, they're very excited and how great UCSD is, like this hospital is. They're always saying how wonderful the nurses are, how wonderful everyone was. Like, they're very excited about this hospital, and it makes me really happy to be a part of that as well.
I came to volunteer because I had enjoyed my time working as a nurse practitioner, nurse midwife over in reproductive medicine, and I didn't want to leave A, the institution, and B, my colleagues. So for me, this was an opportunity to continue working as a volunteer with the group.
I would say to someone who is interested in volunteering but didn't come from any sort of health background that that's actually an incredible asset. I originally came from mechanical engineering product design, a completely different career and industry. And I think that we all bring unique skill set with us. Those tools, those interactions, that perspective is so helpful, and you will connect with certain patients and certain guests in a way that maybe nobody else can.
You know, it's like going to a family when I go to the hospital, because I know everybody. Everybody knows you, and you're not alone. And here I was with nothing to do, and now I had a family, something to do every day, and I really look forward to it.
I would say to someone who's on the edge, uncertain about whether or not they have the time and the experience to volunteer, that this is such an incredible, powerful opportunity. Take that first step, and you will be blown away at the impact it has, not only on your life, but on the lives that you touch when you're volunteering.
Thank you for your time and interest. I personally invite you to contact us and join our team.